Otolaryngology office. Bit of a mouthful, I know. The oto part means ear. Laryngo means larynx, also known as your voice box. But actually, the full name of the specialty is Otorhinolaryngology. Rhino meaning nose. But, for simplicity, we're also known as ENT doctors. Ears, nose, throat. So, how are you doing today? Yes, I saw that in your chart. So, from what I have here, you have quite a few symptoms going on, right? Yes, so I have itchy ears, a bit of pain or tenderness in the nasal passages. Is that correct? Okay, when you breathe, certainly. We have a postnasal drip, which is a runny nose. We have a bit of a scratchy throat and general malaise. That sounds about right. Okay, so I want to ask a few questions before we move to the examination. Are you currently on any medication at all? Okay, that's what I had in my chart. I just wanted to double check. And any supplement use at all? And any allergies? Food, environmental, medication, or otherwise? Okay, very good. Very good. So as an ENT doctor, I do focus on those areas as well as the general head and the neck. Since you are dealing with some issues with the ears, the nose, and the throat, as well as a bit all over, I want to start by taking a look at your ears, if you don't mind. Okay? Alright, so I just want to have a little peek here. So, when did you notice that you were having symptoms? You might just feel me very gently touching the ears. Okay. Kind of been on and off for a while. Certainly. And have there been any other symptoms associated with this? Okay. Very good. And has anything made this better or worse at all? Okay. Alright, well, I do see a little bit of redness right at the opening of the ear canal. So we're going to take a little bit of a deeper look. Let me just pop my speculum onto my otoscope, and then we can take a little look inside the ear. So let's just come over here, pull up and back. So I'm going to get a little closer here, and I am going to very gently here, very gently look around inside the ear. So let me just there into position and buds, or do you put cotton buds in your ears at all? Okay, so that probably would not explain the irritation that I saw in that ear. Alright, well, let's look at the other ear here. There we go. Okay. Yeah, this one, redness, irritation. No swelling, which is good. Discharge or anything like that. But it does look pretty irritated. Okay, so we'll keep that in mind as we keep going. But tympanic membrane looks good. And the rest of the ear canal is clear. No perforation, no signs of infection, anything like that. Alright. Yeah, we'll just have to keep that in mind. And see maybe if we can get a better explanation for that. So I want to check your temperature real quick, just to make sure that you don't have a fever at all. So let me turn this on, and then we can mute it. Don't want the loud beeping. And then I'm just going to put this on the forehead here, and we're going to swipe it down. Okay? No, that's a normal temperature. So let's do a little bit of a hearing test, just to see if maybe this issue is affecting your hearing at all. So we're going to start very simply. I am going to make a sound, one side or the other. I just want you to tell me what side you hear the sound on. So this would be left, right. Just tell me what side you hear the sound on. Good. Nope, tricky right at the get-go. Left. Left. Both. Yes. Good. Yes. Very good. Perfect. So, now I'm going to do some whispering in each ear. I want you to tell me what it is that I whisper. Box. Kick. Top. Bike. Bag. Light. Are those coming in clearly for you? Okay, good. Support. Foam. Facade. Vent. Air. Bedroom. Yellow. Spiral. And all of those came in clearly. Okay, so this is not affecting your hearing. That's good to know. Now I want to do some palpation around your head, as well as looking at your scalp. So I'm going to be just feeling around. It might feel somewhat similar to a massage, but I want to start right here and feel around. So we're looking for lumps, bumps, masses, lesions, things of that sort. And make sure the valleys and hills are there that should be there, and that there aren't any that should not be there. A lot of different contours to the skull. Good. Very good. And looking at the scalp as well. Rashes or any injury, scratches, redness, skin abnormalities, again, lesions, abnormalities, and back in here, good, as well as over here. Good. Okay, that looks pretty good. Alright, so there aren't any abnormalities and the size of the skull is normal, contouring normal. Now, I want to look at a few muscles as well as a joint. So we're going to be looking at the jaw here. We have the masseter muscle in here, as well as the temporomandibular joint. Your masseter helps you chew. Your temporomandibular joint allows you to move the jaw. And we have the temporalis muscle right in here, the temple. This is the time muscle in Latin, chewing muscle in Latin here, masseter temporalis. So you do have a couple more muscles of mastication in here. So the masseter is superficial, it's on top. Underneath you have the pterygoids, which are deep. So we are going to palpate and test these areas just while we're here. So if I could have you just clench the jaw. Good, and unclench. Don't have to do it too hard. We just want a gentle little clench there. Clench, unclench. Good, and can you open the jaw? Close, open, close. Good, can you move the jaw to this side and this side? Okay, there was just a little click in there. Did that feel uncomfortable? It felt a little weird, yeah. It does feel a little odd. But was it uncomfortable at all? No, okay. And let's come up to the temporalis. So if I can have you clench the jaw again. Unclench. Clench. Unclench. Good. So I don't know if you can see on me, but if you clench the jaw, you get that little muscle right in there that bulges out, and right in here, if you clench the jaw, you have the muscle that moves right in here. That's what we were looking at. That all looks great. Now, let's go ahead and look at your lymph nodes. So we are going to start at the back of the head, and we'll move our way up. We'll get around the ears, parotid gland and tonsillar nodes. We'll do under the jaw, get into the neck and the supraclavicular nodes. So I'm going to reach back here, and right around the area where the skull meets the neck on either side is generally where the occipital nodes are. Okay, no distension there. Behind the ears. Good. And in front of the ears, just rolling my fingers, rolling the skin rather. See if we feel any of those, if they're mobile, immobile, distended, or non-palpable. Okay, let's come down. We'll get the parotid gland, tonsillar nodes. Rolling around a little, there we go. And then under here we have submental and submandibular nodes. So we'll just roll those under the jaw. There we go. Luckily these ones tend to be pretty obvious when they're palpable. I've had a distended lymph node right in here, and yeah, you could very easily feel that against the bone. It's kind of an odd sensation. Okay, and then we come into the neck. We have anterior cervical nodes, which means front. We have posterior cervical nodes, which means back, and we have the deep cervical chain of nodes as well. In the front, anterior, and towards the back, this is posterior, and then we have the deep cervical chain. So in the body, anatomically, like we talked about with the jaw, superficial is towards the surface, and deep is deeper inside. Now lastly, we have the supraclavicular nodes. So we have the clavicle here. If we go above it, that is superior. If we go below, that is inferior. So this would be supraclavicular, infraclavicular would be below. Let's just have a feel right here. So supraclavicular nodes. Okay, and those feel just fine as well. Now let's do a little bit of work with the sinuses, and I do wonder if you have any issues with the sinuses. When you bend over, do you get any pain in these areas? Oh, no. And have you ever felt these areas? Were they tender at all? Okay, well, we'll just double check. So I'm going to press in. We're going to start with the frontal sinuses right in here. we will get into the ethmoid right in here, and then maxillary sinuses. So 3 different groups that we can press and tap in. So we're going to press, just like that. And if you could just tell me if they are painful or tender at all, that would be excellent. Very gentle, but firm enough that you can feel it. How was that? Okay, so ethmoid here, let's start on one side. Right in here. How was that? Okay, how about this side? Very gentle. Not too bad. Okay, how about maxillary? Right in here. Here. Okay, good. Now we're going to take it up a notch. And I'm going to just tap along these areas. That's a bit of an accentuation maneuver. And it's a little more, if you had sinus issues, it's more irritating than just pressing. So I'm just going to tap along here. If you could just tell me if it's tender at all. Anything? Good. And on the ethmoid sinuses? Okay, maxillary. Nothing? Okay, excellent. So why don't we go ahead and move on to the nose, the mouth, and the throat, the areas we were having some issues with, right? Yeah, so we've done a bit of palpation around the nose a bit, but I want to do a little bit more. Do a little bit of a deeper inspection. So I'm going to just press around the nares. And any issue here? No. And around the structure of the nose. Okay, the ball of the nose. Right below. Anything with any of that? No? Okay. Let's take a look inside the nasal passages then. I know you had said there was a little bit of tenderness there when you breathe. Does it feel like the skin is kind of raw? Okay. Do you mind tipping your head back? Good. And then I can take a peek inside of the nasal passages a lot easier. Oh. Yeah, it's pretty red, although you haven't been having an issue with the post-nasal drip while you've been in here. And actually, the nasal passages are kind of dry. Yeah, terminates look okay. Otherwise, septum that is midline, no perforation. That seems to be the name of the game today. Irritated, but not a lot else going on. So I want to do a little breathing test with you real quick. I'm going to occlude one nasal passage. You'll get a little nasal. And I'm going to have you just breathe through the other one. Just a few breaths. See if there's any issue. If I just occlude this side here, I'm going to have you take an inhale through your nose and exhale through your nose. Inhale and exhale. Inhale. Exhale. Good. Okay. Any issue with that side? Okay, and right here on this side. Inhale. Exhale. Inhale. Exhale. And how was that? Okay, does it still have that raw feeling? It does. Okay. Can you give me just a couple breaths with both nasal passages open? So inhale. Exhale. Inhale. Exhale. How is that? I'm just a little tender. Okay. Alright, well, have you noticed if it's affected your sense of taste or smell at all? Okay, well, I just want to try this out real quick, so let me just have you take a little smell of this. Can you tell me what that smells like? Okay, it's cinnamon. And if we dump that out and a little bit in here. What does this smell like? Okay, lemon, good. Let's just try one more. There we go. What does this smell like? Yeah, I'll take pizza. Yeah, it's oregano. Part of the mint family, believe it or not. So, why don't we go ahead and just look at the mouth and inside of the mouth and the throat. So, I want to just take a little peek at the lips. So, I am seeing some chapping here. It's pretty common this time of year. As soon as the humidity drops, the skin starts to get dry pretty quick. So, a little bit of Vaseline or chapstick or whatever you like to use, and that'll clear up pretty easy. Okay, the corners of the mouth look good. Right? And I'm going to have you open your mouth, and we're going to do quite a bit of investigating. So I'll give you some breaks to rest your jaw. If you could open your mouth. Okay, first thing, I'm going to have you lift your tongue to the roof of your mouth. There we go. Okay. Yeah, looks good. Floor of the mouth looks good. The underside of the tongue. Excellent. Okay. And I am just going to, while you have your tongue out of the way, I'm going to see. I'm going to need a depressor here. Okay. I'm going to just pull the tissue back a bit. Look at the ducts. Looks good. And the oral mucosa. Okay, keep your tongue up just for a moment. Alright, ducts and mucosa. Okay, go ahead and close your mouth for a second. When you're ready, go ahead and open it back up. There you go. So let's look at the teeth. Looking at the lower teeth to start. Good, and then we pivot, but we can look at the upper teeth. Okay, so I'm going to have you do something a little odd. I am going to put the tongue depressor between your teeth, and I want you to bite down on it. I just want to check your bite and see if there's any abnormalities there. So I'm just going to slide this in here. And if you could just bite down on that. Okay, good. And relief. Did that feel painful at all? Did it feel like there was anything weird in how you were biting that? Okay, so let's go ahead and just put that on the other side then. And bite down. Okay, and release. And was that weird at all? No. Okay, good. So now I am going to be pulling your lower lip down and your upper lip up using the depressor so we can take a look underneath here. So it's going to feel a little strange. Just looking at the gums and the tissue underneath. Good. And above here. There we go. Okay. Now that looks good as well. Alright, so can you stick out your tongue for a moment? We'll just look at the tongue and give you a break for a sec. Okay, so alright, just a touch of scalloping, so probably want to get a little bit more water. A sign of dehydration. But coating looks fine. And tip of the tongue looks good. Everything's okay. Alright, take a little break. And then we will get to the throat. And then that'll be the last little bit that you have to keep your mouth open for. Alright, you ready? Okay. So, open your mouth and stick out your tongue. And I'm going to put on the tongue depressor so we can flatten that out. And then I can look at the hard and soft palates. Okay, and the pharyngeal wall. So, yeah, red, irritated. No cobblestoning. It does look fairly smooth. And do you have your tonsils? You can answer in a minute. Just thinking aloud. I don't see anything there. Okay. That looks just fine. So, let me just take this a little bit. Can you say ah for me? Good. Okay. Uvula looks good. Alright. So, go ahead and close your mouth and relax that for a moment. So, do you have your tonsils or not? Okay, alright. And I'm going to have you do a little swallow test. And this is going to do two things. Firstly, I'm going to be palpating around the thyroid so I can get a little bit of feeling from that, see if there's anything weird there. Another thing we want to look for is dysphagia, which is an inability or difficulty, dysfunction with swallowing. So let me put my fingers right here. And if I could have you take a dry swallow, just like that. Okay, so I didn't feel anything out of the ordinary there. So we're going to move from inside the throat to the neck. We checked on the thyroid real quick, just a little bit. We have the trachea. We're going to look at the sternocleidomastoid muscle. Just this big guy, real thick. A lot of muscle there. We'll look at the trapezius, which is primarily on the back, but comes a little bit over here. And we will listen to your carotid artery. So I'm going to use one hand here because this can be a little uncomfortable. I'm just going to palpate the trachea and make sure it's in midline, right in here, so we don't want it deviating one way or another. Good. Just right there. Okay, and I'm going to take just a little bit of a closer palpation around thyroid area, cricoid cartilage, hyoid bone area. Good. And if I could have you turn your head to the side just so it accentuates that SCM, really get into it. Okay, there we go. Excellent. Just doing a little bit of palpation, just like I was here. A little bit of pinching. It's very thick, corded muscle here. Okay. And the other side, that I can just palpate into that. There you go. Very good. That looks good. Yeah. Anterior section, behind it, posterior. Very good. Okay, and the trapezius here. Just feeling back of the neck, top of the shoulders, around the neck. Good. And do you have any particular pain with the trapezius muscle? A lot of people do. It's a muscle that can get pretty tied up, get a lot of knots in here. Can you give me a couple of shrugs just so we can look at the function of the trapezius there and our accessory nerve? There we go. That's good. Alright, so it doesn't look like there's any weakness there. We had a good bilateral lift, which is good. So let me grab the stethoscope and we can listen for bruits in the carotid artery. So bruits, B-R-U-I-T-S, bruits, they are audible heart murmurs. And if we do have a bruit, we don't want to be touching the carotid artery. Don't want to upset nothing. So, can I have you just turn your head to the side here? Okay, and I'm going to put the diaphragm of the stethoscope right here. And I'm going to have you take a deep breath in. And just hold for a few moments. That way I'm not getting the sound of air traveling through your windpipe. And exhale. Okay, turn your head to this side. There we go. And just take a deep breath in. Hold. And exhale. It's a bit of a long one, but no bruises. So, I am going to palpate the carotid artery one at a time because, again, this is not a very comfortable area to have two hands jabbing in. So, you can just have your head at neutral, and I'm going to just feel right here. I'm feeling the strength and the quality of the pulse. Good. The other side. Okay. Yeah. That feels great. So, we still have yet to talk about what is going on with the itchy ears and the throat stuff, the nose stuff, the malaise. And my friend, I believe you are dealing with some nasty seasonal allergies, unfortunately. It's been a really bad year for them. So there's a few different things going on here. You have to think about what kind of plants are blooming, which you might not know too much about plants, but if you're out and about, just kind of look around at what's going on. So last we had was a big goldenrod bloom. We also had ragweed, and those are extremely irritating. If you've ever seen a field of goldenrod, it's just pollen central. It's a lot of pollen. So you have those two, and it's also harvest time. Luckily, it is almost done. Harvest time is. But you kick up all that dust and all the plant matter, and that's just in the air. Really irritating, but there are some things we can do. So, in terms of things that anecdotally I tell people, allergies is one of those fun things that pretty much make you feel super odd and just really bad all around. So even though you may not want to, sometimes the easiest thing to reduce symptoms is to immediately do some activity, basically just going about your day, and a hot shower can also help quite a bit. It can help clear out what's going on a little bit. But for some reason, doing activity, not even necessarily exercise, just going about your day instead of laying about and not feeling well, that seems to reduce the symptoms, anecdotally. Otherwise, we do have a lot of different allergy medicines on the market these days, and there is a lot. But every person responds differently to them, and they may respond differently every year. So you have a plethora of choices to try out, and one may work better than others. One may not work at all. It really is a lot of trial and error. It's a lot of trial and error. And what works this year might not do very much next year, but something that didn't work this year could do better next year. It's a fun cycle. But there are both pills and sprays. I don't have a lot of experience with the sprays, and if those are more helpful than the pills, that's up to you to try. If that's something you're interested in, that's up to you. So, did you have any questions for me? I wish I had a better answer for you. Like, I could just prescribe one thing and it would take care of it, but it's trial and error. Okay, well, otherwise, so mostly what we dealt with today was irritation in the ears and nose and throat, which coincides with what you had said, although we didn't have any postnasal drip as of now, and actually the nasal passages were quite dry, which certainly is a thing that happens. Vacillates between the two. So a lot of water. Hydration is going to be very helpful, and taking a shower, not necessarily a bath, but a shower, really building up that steam, and medicine, and just kind of babying it. All right? Okay. It was a pleasure working with you. I hope this feels a lot better soon, especially with the harvest almost being over. As soon as these temps drop, it'll be a lot better. I promise you, it'll be a lot better. And then it'll all start again in the spring. I'd like to thank you so much for coming in the office. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, I have a link to my Patreon in the description box below. I offer perks like early access to videos, ad-free videos, Patreon exclusives, audio downloads of all my content. Thank you for being here. I hope you have a whale of a day. And a good rest of your